In 2017, I had a stroke which affected my balance and mobility. Several years later, I had a sudden onset of visual difficulties, blurred double vision, and the effects of the stroke were beginning to have an impact. I was then referred to eye clinic. During my appointments in eye clinic with the ophthalmologists, they explained they would refer me to Sarah, who was the ECLO, the eye clinic Liaison Officer.
ECLOs are based in clinics, and we provide emotional and practical support to not only patients but to their carers, family, relatives, to help them to navigate between social care services and health. Initially, Bev was referred to me because she was having a problem with her mobility and depth perception, and it was really affecting her. Some of the things that we could offer were referrals to outside agencies as well as RNIB. So there was a referral into the Rehabilitation Service, and we referred into Managing Better then as well, because we talked about things like lighting and a home health assessment.
Managing Better caseworker would have completed a home visit, and this would entail completing what's called a Healthy Homes check. Within this Healthy Homes check, we do a full assessment of the individual, the household, and also the loved ones within the property, so carers, family. Caseworker would also arrange for minor adaptations to the property.
One big piece of advice was to change the light bulbs. To be honest, when she told me that, I did think, I don't quite know how that is going to make a difference for me. Possibly the week later, the guys from Care and Repair came along with the light bulbs, and I walked around my home. It was like I'd moved into a new house. It was so bright. It was incredible.
By us providing small interventions and adaptations for Bev, this has helped build the confidence both in and outside the household. By putting in a small intervention, it's made quite a big difference. The caseworker had referred through to Sandy, who's the ROVI, the Rehabilitation Officer for Visual Impairment within the sensory team.
Before Bev had her stroke, she was a very active person and very bubbly, laughed a lot. However, when I met her first, that wasn't Bev. So all the way through my assessment with Bev, it was what mattered to her, and what mattered all the way through was her independence. We looked at her goals and aspirations and what Bev wanted to achieve throughout the process. One of the big things was actually going out. So I started off with orientation and mobility and actually getting Bev out of the house.
We started by just going out the door, really, because I hadn't done that for quite a long time. As well as the physicality of walking and negotiating, being out and about, it was the confidence for me to be able to meet other people. Felt like sort of integrated me back into the world again.
Bev was really struggling with her medication, and it was either her husband or family that had to administer it. So I did a referral through to pharmacy team.
I had the referral from Sandy, and the reason being that she'd been out to see Bev and she was struggling with managing her medication independently. We worked together with Sandy and with Bev to try and find a solution, and the one that we came up with was a blister pack. So this was done by a community pharmacy and would mean that Bev would manage her medication independently but safely. We found working together as a collaboration, integrated working with health, social care and third sector has been ideal for Bev, not just for Bev, for most of the people that we work with. For us in pharmacy, we wouldn't know about these people that were having their problems with their meds if it wasn't for the professions referring.
I've been working with Bev now for about 16 months, and through sheer determination on her behalf, she's now travelling by bus, train, she's accessing her local community. I'm really proud of her just getting out there and doing what she's had to do.
It has had an overwhelming, uplifting effect on me and given me the confidence and the ability to face the future and be out and about. It's very important for my family, particularly my grandchildren who are young, to see and understand that no matter what adversities you might have to face in life, provided you find the right support, you can do anything, you can deal with anything. Nothing needs to stop your life.